This is Average Joe PT, and we're all about, in this segment, of where the heck is the pain coming from? Isn't that right, Skully?
Yep, trying to figure out where this pain coming from.
That's right. And today, we're going to talk about this thing. We're going to talk about the main basic foot problem that most people have. So stay tuned. Now, when we're talking about the basic foot pain, isn't that right, Skully?
I ain't got no feet.
I know you ain't got no feet. But for the rest of us, when it comes to having this kind of foot pain, and it's what we call plantar fasciitis, which is, woo, that's a big word. I'm going to leave it right up there with that foot. Boom! Look at that pic. And so that gives you a decent idea of what we're talking about. And that can hurt all the way. I'm going to zoom right in close on you here. If you look at that foot right there, that pain goes right from your heel, come all the way up through your feet on the bottom. So every time you take a step with that, you get that stretch. That tissue just kind of stretches and then comes back, and you get all that pain. And what that's from is these things called micro tears in the fibers of the bottom of your foot. And so you have that micro trauma, and that gets things inflamed. And so when you first take that step in the morning, you get that instant pain, and then it kind of eases up as you go along in the morning. So the best bet to do with that early on is to ice it and rest it. How do they normally get plantar fasciitis? You can get it from poor footwear. You can get it from, maybe doing an activity that you normally don't do. Maybe like wearing flip-flops or sandals, and you did a lot of walking that day, and you got the bottom of your foot all inflamed. And so you go home, rest it for a few days, and make sure you ice it and probably take an anti-inflammatory, and that will usually calm it down. But if you keep going back into that, keep getting that thing inflamed, you can really have a chronic problem on your hands. And so I usually tell people, before you even get out of bed, you want to stretch it in the morning, stretch that bottom of that foot. You want to take that heel, hold it right there, and then just pull and stretch all that tissue on the bottom of your foot. And then you do that for 30 seconds or so, and then you go ahead and start your day. Now you also might want to take a ball and roll on it. Now I'm going to leave a little link up here. I got all kinds of videos on foot pain and ankle pain that you can go over. Exercises, stretching, different type of techniques to reduce the pain early on when you have that acute inflammatory phase. So if you guys have any questions, you can go ahead, good or bad, positive or negative, isn't that right, Skully? He's quiet again, jeepers. When you want the guy to talk, you don't talk. Leave that comment down below. I'm hoping you guys will subscribe. Skully and I, we're bringing stuff as much as we possibly can. I have all kinds of content on here. And like Skully and I like to say, until next time, we want you to look up and keep smiling. See you next time, folks.